All right, good evening, everyone. Welcome to a new module 13. We talked about so many things in our previous module, and so right now, last module we discussed, module 12, A, B, C, and D. We talked about prevention of disease, infections, safety from harm, and also first aid measures as to specific conditions like choking, uh, some emergency situations like cerebrovascular accident, as stroke, and also myocardial infarction, which is heart attack. I also talked about dizziness or fainting. We talked about fall. We talked about a lot of things in general. So now today we are moving to a new module, which is module 13. And we are starting with the first part, which is module 13A. And the topic is personal care. Before we move into or dive into the main body uh, of this particular topic, I want us to have a baseline knowledge or a self-taught knowledge on what personal care is. You know what? Even right from primary school, we've been hearing personal hygiene, personal care, taking care of your personal things, your personal belongings, personal. It is a common word, and we are not so far from it. And we are not too knowledgeable about it. So personal care is just simply or simple put a way of taking care of your what of yourself now of the body. A person, personal from the word person and care from the word from caring. So personal care is just how you take care of the body, either your body or the body of your patient. So dive quickly into the introduction aspects as to what personal care really means. Now, personal care means providing care that is related to the patient's body, the patient's appearance, the hygiene, and movement. I repeat, personal care means providing care that is related to the patient's body, patient's appearance, patient's hygiene, and movement. So the tasks related to personal care include bathing, teeth and mouth care, dressing and grooming, toileting, and these are an example of personal care products. We have the soap, we have the mouthwash, we have the dental floss, we have the toothbrush, toothpaste, shaving cream, deodorants, masks, serum, batter, and even conditioner, air conditioner. So, continue from activities that the task that we can categorize under personal care. You said dating, you said toileting. So consider from toileting, we have eating, ambulation, that's movement, transferring either from bed to chair, from chair to bed, from chair to bathtub, transferring patients, then care of the patient's environment. Care of the patient's environment is very, very important. And assisting with self-administration of medication. Assisting with self-administration of medication. So people may require personal care for a number of reasons. Now, assistance with personal care may be temporary while the person is recovering from an injury or from an illness, or it may be permanent. We said many times as we talked about the types of disability, as we have the permanent and the temporary. So if it is a temporary disability, the patient will, of course, not need this care for the rest of their lives. They need the care throughout the process of recovering. So after the recovery phase is done, the patient as well, regains the ability to do something for themselves. But in cases whereby the injury is permanent or the disorder is permanent, this patient may need this care for the remainder of their lives, and throughout their lives. So this is an example of someone who is currently being assisted in the bed. Now, who are the types of patients who may need personal care? Now, types of patients that need personal care include patients who are recovering from an illness or an accident. Now, patients recover from an illness, for example, people who had surgical procedure done and is recovering, or someone who had an accident and had to fracture his or her hands or some part of the body got fractured. Of course, this patient needs what personal care because why? They have been debarred or they are unable to perform some tasks for themselves. Then patients with a long-term chronic condition like cardiovascular failure, that's heart failure, or diabetes, or HIV and AIDS. And these patients are also categorized under those that needs what personal care. Then frail patients or those advanced in age, elderly patients, adults, about well, I wouldn't want to categorize his age, but we know who an adult is, and those are advanced in age, like maybe from 70 to 50, even as the case maybe is 60, may also be part of the frail patients or advanced patients in age. The patients who are permanently disabled, they also need what? Personal care. Then dying patients who are dying, so they need a lot of care, personal care. They are dying because they like especially patients in the ICU that are having intensive care. So those patients need what personal care. And infants whose caretakers need assistance caring for them. Of course, infants infants are they can't do anything for themselves. So when the caretakers, as the mother, needs assistance, they also fall under what those that need personal care. So providing personal care is a priority for home health aid or personal care aid. And it is most important task they do. Personal care provision demonstrates to the patient's concern uh, about demonstrate the patient concern about their physical health and their general well-being. So personal care is one of the most important aspects of our duty. We don't take care of the patient's personal hygiene and environment, as well as helping them with movement and transfer and everything. We'll see that we'll only render a few meaningful care. Because imagine you cooking for a patient and you're cooking a dirty food. There is no personal hygiene. There is no hygiene. Once eating his dirty and the place is even using to eat is dirty. You see that you will end up killing the patient or even complicating the issues more. So personal care is an integral part that we need to inculcate into our skills, the skills we learn. We need to inculcate uh, personal care into it. And of course, we know that if you don't know how to take care of yourself, you can't take care of your patients. That is the truth. So learning to take care of your own personal hygiene and as well as that impacting or transferring that into your patient. So we have to be concerned about their physical health and their general well-being. So this module in general, the module 13, will explore the importance of providing personal care and provide instructions with performing tasks related towards personal care. The importance of infection control and how home health aides or personal care aides can work to break the chain of infection in order to keep patients healthy will also be discussed. And bathing, teeth or mouth care, dressing or grooming, toileting, and eating are topics discussed with explanation on how home health aides or personal care aides can provide assistance with this type of personal care. Transferring patients to and from various positions and also assisting them with ambulations are also detailed in this module. Care for the infant with regard to proper holding, feeding, and bathing is also discussed. And finally, for home health aides who will assist with self-administration of medications, the importance of the 5 rights of medication self-admission, which is the right patient, the patient must be right medication, right dose, right route, the right time are also reviewed. Now, these are called the 5 rights of medication self-administration. 5 rights of medication self-administration. I repeat, the right patient, having the right patients to serve the right medications to, then in a what? In the right amount, the quality, the quantity, right? The dosage of the drug must be correct. And the right route, you cannot give IV drugs, you cannot give IM drugs into IV because they can be very, very complicated and detrimental to the patient. So, and also the right time, the drug should be served by 8, should not be served by 10, and the drug should be served by 10, should not be served by 8. So, right time, these are also reviewed. And this is an example of someone helping and assisting with uh, care. So we've come to the end of this first module. This first module is just a brief introduction into what we'll be discussing generally. So just a brief recap again. We understand what personal care is and what it means, and things that are related to personal care like bathing, teeth washing, and dressing and toileting and the like. Then I told us about the care products and also patients who may need care and what this module is generally about. So in conclusion, before we end this module, this particular section, cleanliness is next to godliness, they say. So patient hygiene. A patient's appearance will make even themselves comfortable or make them feel uncomfortable, depending on which. If the patient looks good, they look bright, they will definitely look cheerful. When a patient is left stuck, dirty, no care, they become even sicker. And other sicknesses will add up to their current sickness, and that is going to be quite detrimental for your patients. So finally, he said for home health aid who will assist with self-administration of medication, you must also understand not just about personal hygiene, but also about administration of drugs, self-administration of drugs, which is the right patient, the right medication, the right dose, the right route, and the right time. Thank you very much. Have a wonderful evening.